My name is Kenneth, and I was diagnosed with prostate cancer in February of 2021. If I hadn't had the test done, I never would have known. I might have went, I don't know how many years with that. The reason I believe it's so important to get screened early is to save your life. It is a game changer. It's to save your life. It's for yourself and your family and your loved ones. It's so that if you do get diagnosed with prostate cancer, it's a lot better to be diagnosed. The earlier, the better.
Ideally, a prostate exam would be done in a man who's between the age of 50 and 75. If you have a family history of prostate cancer, we think you should start earlier, about 45. I think the prostate exam is something a lot of men dread, and it does add value. I would hope people wouldn't let that stop them get screened, but rather the blood test is our most important indicator. So starting with that and then moving forward with an exam, if necessary, is a completely okay way to approach screening for prostate cancer. So PSA is prostate-specific antigen. It's a protein that your prostate makes, and it is released into the bloodstream. And people with prostate cancer have more release than people without prostate cancer, and so their levels are elevated.
I go and get checked every 3 or 4 months, and because I got it early and everything, up until this point, which is going on 2 years now, I haven't had to go for any extra treatments or any of that.
With prostate cancer screening, we want to know when the disease starts, but also the way PSA works is if we can trend it, it can be helpful for diagnosing prostate cancer. So having regular screening is important. And if you haven't had regular screening, then it's always a good time to start. Ideally, if you identify yourself as someone who wants to be screened for prostate cancer, you'd access your primary care provider. And they talk to you about the benefits of screening, and then if you wanted to proceed, you'd get a blood test done. You'd follow up. If the blood test was low, you could feel confident and you could get screened again the next year. If it's somewhat elevated, there's likely a second blood test done, and if that's still elevated, you'll come to see one of the urologists in New Brunswick, and we'll talk to you more about the next step. The best way to book an appointment for prostate cancer screening is through your family doctor or your nurse practitioner or one of the online portals that are available to New Brunswickers free of charge.